on the Honourable Dahlia A. Loyola. She is the chairperson of the Committee on Poverty Alleviation in the Philippines Congress House of Representatives. So, Honourable Ms. Loyola, over to you.
I would like to express our advocacy for the following significant actions in order to promote primary health care in the Asia-Pacific region. In the case of the Philippines, we need to push for the full realization of the potential promise by RA 11223 or the Universal Health Care Act. All the reforms which were stalled due to the pandemic should be aggressively pursued. It may be safe to think that our neighboring countries also need to do the same. This law must be strongly supported by the creation of the Philippine Center for Disease Control and Prevention and the Virology Institute of the Philippines. This would definitely require much-needed funding as they are investments in the well-being of our people. We as legislator should allocate a significant larger slice in the budget pie for the promotion of primary health care. In the implementation of PHC, one crippling statistic for the Philippines is our lack of medical personnel and our lack of a fundamental framework on primary health care access for all 111 million Filipinos. According to the University of the Philippines, there are about 3.7 doctors per 10,000 Filipinos. We need to capacitate our healthcare facilities with healthcare personnel, ideally led by a physician in as many parts of the country as possible. That is why we welcome the passage of Republic Act No. 11509 or the Doktor Para sa Bayan Act. In Filipino, Doktor Para sa Bayan can be translated to a doctor for the people. This newly signed law provides medical scholarships for medical students of state colleges and universities and establishes a national return service program to enable access for Filipino residing in far-flung areas of potentially primary healthcare networks. At the same time, pending before the House of Representatives is House Bill 6395, filed by my colleague, internationally renowned health economist, Representative Stella Kimbo of the 2nd District of Marikina City. This measure is the Primary Care Network Adequacy Act, which mandates the Department of Health to develop standards for primary care adequacy in all plans and proposals. It also enables the department to conduct capacity building for persons to be part of these primary care networks while mandating their funding from the Special Health Fund established under Section 20 of the Universal Health Care Act. This fund shall be developed by the Department of Budget and Management, the Department of Health, local government units for purposes of fiscally capacitating their primary healthcare facilities and personnel. We hope that this measure can be passed in time by both the House of Congress and eventually signed into law to fully provide the resources needed to establish primary healthcare providers in the Philippines. Finally, we must also adopt a whole-of-society approach in the promotion of self-care through education. We believe that when people value their own lives and good health, they will take the initiative to seek professional medical help. Self-care should result in people adopting a healthy lifestyle, which includes the search for immunization, demand for quality health services, and participate in health education of others. Together, we can motivate world organizations to effect more equitable access to vaccines, medicines, and relevant research on best health practices. Further, we should encourage good governance among our leaders, as it has a direct impact on the effectiveness of public programs and policies, including primary health care. In solidarity, we could achieve a healthier and more sustainable developed region.
Thank you so much, Honourable Ms. Loyola, for that perspective from the Philippines.